Now, the past 36 hours, I think we would agree, have been dominated by revelations about Colchester Hospital. It's all after the CQC, the Care Quality Commission, inspectors found that some cancer patients may have had unnecessary delays in treatment. We've also been hearing claims that staff were put under pressure to change records on waiting times. Now, the Trust has written to 30 patients offering a review of their treatment, but what are your rights if you feel that you have been adversely affected by anything that's gone on here? What are your rights? Well, Peter Savage is a clinical negligence partner at the law firm, the Medical Accident Group. Peter, good morning.
Good morning, Dave.
So, if you are affected by any hospital or doctor's apparent negligence, what can you do?
The claimant can approach a firm solicitor specialising in clinical negligence to see whether or not they would have any claim for damages arising out of the failure to treat or the delay to treat or diagnose in this case, cancer. Now,
go on.
Now, claims for clinical negligence are difficult cases to pursue, so it's essential that the claimant approach specialists in this area. And what they would need to show was that the medical treatment fell below an acceptable standard that a reasonable body of medical opinion would find acceptable. And secondly, the claimant would have to establish that but for the breach of duty, the damage or injury would not have occurred or would not have been as serious. In this case, where it's a cancer case, the cancer has developed and obviously has become more serious as a result of the delay.
Right, so if there has been delay, but you can't prove that your cancer has become more serious as a result, you would not have a claim?
No, you would have to prove the big hurdle in clinical negligence claims in cancer claims is the causation hurdle that you have to overcome.
So damage, you've got to prove damage?
Yes, you would have to prove damage. That said, there are some cases where people are misdiagnosed the wrong way, where they don't have cancer, and cancer has been diagnosed, and they can still, in some circumstances, pursue claims.
How expensive is it to pursue a claim? Because most people nowadays just would shy away from any sort of legal claim.
Well, it is expensive, but most solicitors would undertake these types of claims on what are called conditional fee agreements. Now, under those agreements, they're known by laymen as no-win, no-fee agreements. And under those agreements, the solicitor will recover their charges from the other party. In this case, it would be the NHS Trust. Now, up until April of this year, the solicitor would recover all of their costs from the other side. Following the implementation of the LASPO bill on the 1st of April this year, the solicitor now recovers most of their charges. However, they no longer recover a success fee, or if they've had to take out legal expense insurance, they don't recover the premium for that either.
So who pays for the rest of it?
That would now come out of the client's damages.
Right, OK, so the client's damages will be cut down accordingly?
Yes, now it's limited to 25% of general damages or past losses, and there's a lot of firms now that will undertake claims for children without any deductions.
What happens if you lose?
You're covered by the insurance, and the premium pays the other side's costs, and the premium pays for itself. And
do you have to pay this premium up front before you take the case?
No. Most solicitors will arrange insurance premiums that are self-insuring and that pay for themselves at the conclusion of the case.
Because I'm just very concerned that people might not take claims because it's so confusing to do so and so potentially financially damaging to do so. But what you're saying is it doesn't need to be that way.
No, it doesn't need to be that way, and that's why it's essential to approach specialists in this field. They will certainly undertake most clinical negligence claims on the basis of a no-win, no-fee agreement and ensure that the appropriate insurance is put in place.
And Peter, if you are suing a hospital, how easy or difficult is it to get information from that hospital? Because again, in the past, this has been a bit of a nightmare, hasn't it?
It should be easier than it is. There is a protocol in place whereby the hospital or the practitioner has to disclose medical records, and that's meant to be within 40 days of the request. In reality, sometimes it is a bit of a headache to get the records.
Looking at Colchester, and you've been hearing about what's been happening over the last few days, do you see the possibility that the hospital could face a wave of legal action?
Absolutely. The cancer unit there treats approximately 6,000 patients a year. They have looked, as part of this review, they have looked at 61 cases, and their concerns have been raised in approximately 22 of the cases, so a third of the 61. So if one looks at 6,000 cases since, say, 2010, that's over 20,000 cases. And if you look at the 22 out of 61, you can do the maths and work out how many potential claimants there might be out there.
So they could be facing a massive claim?
Absolutely.
How long do these claims take to go through?
The more straightforward ones can be sort of 12, 18 months, but the really serious claims can drag on for 2-3 years, unfortunately.
And in some cases, I guess the claimant passes away before the claim's finished, do they?
Yes, unfortunately.
What happens then?
The claim can continue. The claim can continue and be pursued by the personal representatives of the deceased.
Right. So this is just a yet another potential knock-on effect of what's been happening.
Yes, absolutely.
How much does the NHS pay out a year? And this is a big question. I'm sorry, you may not know the answer to this, but do you know roughly how much they pay out a year in negligence damages?
Hundreds of millions.
That much?
Yes, if not more.
And is it? I mean, what's the most common thing that comes to you? Is it delay? Is it getting a diagnosis wrong? What's the most common thing that you see?
There are all types of things: surgical errors by both hospitals and GPs, late diagnosis, the birth injuries. That runs the full gamut of things that can go wrong when one visits a medical practitioner or undergoes surgery.
Is it better, if you feel that you have got a case, to take part in a group action? So getting together with a whole group of other people who have similar cases, or is this not appropriate
No, they're not really appropriate. The group actions are appropriate, for instance, in relation to the breast implant scandal that broke recently.
Which is all the same stuff? Yes,
and it's one product or one manufacturer. In clinical negligence claims, the claims are all brought separately by the individuals or their families.
Peter, really, really interesting. Thank you very much indeed. Peter Savage there, clinical negligence partner at the law firm Medical Accident Group.